So I think this is one of the most exciting partnerships that Kootenai Health has ever undertaken. The affiliation with WSU has been just such an amazing opportunity for our growth, and again, an opportunity to contribute to the future physicians of tomorrow. And that's what, as physicians, we have a professional responsibility, an obligation to ensure that our future is well cared for. And that's the exciting opportunity of us to actually play a role in the foundation of their education and what they actually develop into, and sort of say pass the clinical baton and watch great things happen.
There are only so many pediatricians teaching, and in Washington State there's a shortage of pediatricians, and in order to get our students access to those learning environments, that means a pediatrician has to take the extra time, and some of them just can't do that. And so having the additional partnership with Kootenai Health has provided our students with learning opportunities outside the classroom in clinical care environments where they wouldn't exist otherwise.
Children are the best way to learn medicine because they are so variable. You've got the ages right from birth to 18. So you get your adolescents and they're much more adult-like and they can tell you more, right? But you got your 2-year-old who is screaming bloody murder and will not even let you touch them, right? And they're here for, they're breathing fast and they have a fever and you have to look at their ears. And you can have the most experienced student or resident with like all of the adult experience in the world. And in that moment, I see them freeze. And so I think it's a good skill to get them comfortable with being uncomfortable.
I would say one thing that's fun about pediatrics is that kids as opposed to adults seem to get a lot better really fast sometimes. And it's kind of fun being able to see them go from this really, really low state to completely improved within a couple of days.
So basically, Dad was telling me that she is actually a pretty healthy lady. Been doing pretty well, got that nasty COVID back in September, and just since then has been having that little bit of like coughing and difficulty breathing, usually when she exercises, because she is a gymnast.
I did grow up down in Colfax, Washington, and it's been really fun to be able to train over on this side of the state of Washington as well as North Idaho, and get to really train serving the communities of people of who I grew up around and who I grew up with, and it's been a very rewarding experience. And I think definitely someday I would love to return to this community and be able to serve them as a provider as well.
That's the end game, right? That's the goal, is to make really good doctors.